Hello, friends. What I'm about to tell you is not a rumor, not a prediction, and not something I found on a random website. This comes directly from the Kaiser Family Foundation, one of the most respected health policy research organizations in the United States. And what they found should be in every senior's inbox, on every kitchen table, and in every conversation happening between adult children and their aging parents right now. 2.6 million seniors enrolled in Medicare Advantage plans will lose their coverage in 2026. Not reduced, not modified, gone, terminated. The plan they signed up for, the plan they've been paying into, the plan that covers their doctors, their prescriptions, their dental visits, their OTC allowances. It is being canceled. And the most alarming part is this: the majority of those 2.6 million people have no idea it's happening. I went through the Kaiser Family Foundation data carefully. I went through the CMS notices, the insurer announcements, and the state-level warnings that have been issued over the past several months. And I decided this needs to be said plainly, because the people who are affected most are the ones least likely to have seen any of this covered anywhere. If you are on Medicare Advantage, or if someone you love is, watch this entire video and then pass it to them. Because what I'm covering today is time-sensitive in a way that most Medicare news is not. Before we go further, subscribe to this channel right now and turn on the bell notification. Here is exactly why that matters. The changes I'm talking about today are not the only ones coming. Medicare rules, insurer decisions, and federal policy are shifting faster in 2026 than they have in years. What I do here is track all of it, read through the official documents, cut through the confusing language, and bring you what actually affects your money and your coverage before it becomes a crisis. The people subscribed to this channel find out while there is still time to act. The people who aren't tend to find out when the letter arrives and the deadline has already passed. Hit subscribe, turn on the bell, and let's get into what is actually happening and what you need to do about it. Let me start with the number itself, because 2.6 million is not a small figure, and it deserves to be understood properly. According to the Kaiser Family Foundation analysis, approximately 13% of all seniors currently enrolled in a Medicare Advantage prescription drug plan will have their plan terminated for 2026. That means 1 in every 8 seniors on Medicare Advantage is affected. To put that in perspective, that is more people than the entire population of the state of Nevada losing their health coverage at the same time. And unlike other Medicare changes that phase in slowly, a plan termination is immediate. On January 1st, your plan is gone. Now here is what most people don't realize about how this works. And this is the part that has been catching seniors completely off guard. When your Medicare Advantage plan is terminated, you do not automatically lose all Medicare coverage. What happens instead is that you get quietly moved back into original Medicare, the traditional government plan, by default. That sounds okay at first, but here is the problem. Original Medicare does not cover dental. It does not cover vision. It does not cover hearing aids. It does not cover the gym memberships, the grocery allowances, the over-the-counter spending cards, or the transportation benefits that many Medicare Advantage plans include. And depending on what your terminated plan was covering, the switch to original Medicare could mean thousands of dollars more out of your pocket every single year. There is something else that almost never gets explained properly. If you are moved to original Medicare, you may also need to act quickly to get a Medigap supplemental policy to cover the gaps that original Medicare leaves open. Things like co-payments, co-insurance, and deductibles. But here is the critical piece. Medigap enrollment rules are strict. In most states, if you wait too long or miss your window, insurers can charge you more or even deny you coverage based on your health history. This is not widely known. And for seniors who assume the transition is automatic and handled for them, discovering this window exists after it has already closed is a devastating experience. So why is this happening? Why are 2.6 million people losing their Medicare Advantage plans all at once? The answer involves money, and it is important to understand because it also tells you what is likely to keep happening in the years ahead. Medicare Advantage plans are run by private insurance companies, not the federal government. Companies like United Healthcare, Humana, Aetna, and dozens of regional carriers. These companies receive payments from the federal government for every senior they enroll. For years, they competed aggressively for enrollees by offering extra benefits: the dental, the vision, the grocery grocery cards, the gym memberships. These perks were funded partly by the federal payments and partly by keeping claims costs low. But medical costs have been rising sharply. Federal payment rates have been adjusted, and many of the supplemental benefits that were offered generously in previous years are no longer financially sustainable for the insurers. The result is that carriers are exiting counties, exiting states, and in some cases, shutting down entire plan lines. UCare, a major carrier in Minnesota, eliminated its Medicare Advantage program entirely, leaving nearly 200,000 seniors in that state scrambling for alternatives. Similar exits are happening in rural counties across the country, where enrollment numbers are smaller and provider networks are harder to maintain. And according to the Kaiser analysis, an additional 1.3 million seniors, on top of the 2.6 million losing plans entirely, are enrolled in plans that are being consolidated or restructured, meaning they may be automatically moved into a different plan that they never chose and never reviewed. Let me explain what that automatic reassignment actually means in practice, because this is where real harm happens. When an insurer consolidates plans, seniors in the terminated plan are often moved into a different plan from the same company. That new plan may have a different premium. It may have a different network of doctors, which means your current physician may no longer be covered. It may have different drug coverage, which means the prescriptions you take every month may now cost significantly more, or may require prior authorization that wasn't required before. And because this happens automatically without you actively choosing, many seniors do not discover these differences until they show up at their doctor's office and are told they are no longer in network, or they go to the pharmacy and face a bill they weren't expecting. There are things you can do, and the time to do them is now, not in October, not when the letter arrives, and certainly not in January when the new coverage year has already begun. The first thing to do is check whether your specific plan is being terminated or changed for 2026. If you are enrolled in Medicare Advantage, your insurer is required to send you an annual notice of change by late September. This document lists every change being made to your plan for the coming year. Most seniors receive this notice, set it aside because it looks like standard insurance mail, and never read it. That letter contains information about premium changes, benefit reductions, network changes, and in some cases, the notification that your plan is being discontinued. Read it, every page of it. If you have already received a termination notice, or if you are concerned your plan may be affected, you have options. The annual enrollment period for Medicare runs from October 15th through December 7th each year. During this window, you can switch from one Medicare Advantage plan to another, switch from Medicare Advantage back to original Medicare, or add, drop, or change a Part D prescription drug plan. This is your window. Missing it means living with whatever coverage you have, or whatever coverage you were automatically assigned, for the entire following year. If your plan is being terminated and you are moved back to original Medicare, pay close attention to your special enrollment period. When a plan is terminated involuntarily, you may qualify for a special enrollment period that allows you to make changes outside of the normal October to December window. This is not well publicized, but it is a real protection that exists specifically for people in your situation, and you are entitled to use it. The second thing to do is call 1-800-Medicare. That is 1-800-633-4227. This is the official federal helpline. When you call, tell them your Medicare number and ask them directly, "Is my plan being terminated or changed for the coming year?" They have access to your enrollment information and can tell you exactly what is happening with your specific plan and what your options are. You do not need to figure this out alone, and you do not need to rely on anything you read in an advertisement. The third thing is to be extremely cautious right now about who is contacting you about your Medicare coverage. Every time there is a major Medicare disruption, and 2.6 million plan terminations absolutely qualifies as a major disruption, scammers move in immediately. They know that seniors are confused, that they are worried about their coverage, and that they are looking for answers. You will likely see more calls, more mailers, and more door-to-door visits from people claiming to help you find a new Medicare plan. Some of them are legitimate licensed brokers, some of them are not. No one is allowed to cold call you about Medicare unless you have given them permission to contact you. No one is allowed to show up at your door without an appointment to sell you a Medicare plan. If someone contacts you unsolicited about your Medicare coverage right now, do not give them your Medicare number, your Social Security number, or your bank information under any circumstances. Hang up. Call 1-800-MEDICARE directly. Now, I want to address something directly because I know this is frightening, and I know some people watching this are already dealing with a termination notice that arrived and caused real anxiety. What I want you to understand is this. Losing a Medicare Advantage plan is not the same as losing Medicare. Your Medicare coverage itself does not go away. What changes is how that coverage is delivered and what extra benefits come with it. The situation is serious, it requires action, and it has real financial consequences if you don't act in time. But it is not a crisis that cannot be managed if you know what to do and you do it before the deadlines pass. Here is the summary of everything I've covered. The Kaiser Family Foundation has confirmed that 2.6 million seniors will have their Medicare Advantage plans terminated in 2026. That is 13% of all Medicare Advantage enrollees. An additional 1.3 million are affected by plan consolidations that may change their doctors, their drug coverage, and their benefits without them actively choosing anything new. When a plan is terminated, seniors are moved to Original Medicare by default, which does not include dental, vision, hearing, or supplemental benefits. Seniors have a specific window, October 15th through December 7th, to choose new coverage, and in some cases, a special enrollment period if their plan was involuntarily terminated. The number to call is 1-800-MEDICARE. And right now, scammers are actively targeting seniors who are confused about these changes. So do not share your Medicare number or personal information with anyone who contacts you unsolicited. Subscribe to this channel. Share this video with someone you know who is on Medicare, especially if they are the kind of person who sets insurance mail aside and deals with it later. That habit is dangerous right now. And I will see you in the next one.